Fertility is hard to talk about, but so many people struggle to conceive. So let's explore this topic further. And action. So Jo, I know in my professional world, people are very fearful of talking about sex, and it's not so far removed with what you're talking about. So why is it that many people struggle with infertility?
It's a fear of the unknown predominantly, a fear of what might be uncovered in terms of, if there's any concerns with respect to fertility. And in some cases, a bit of an embarrassment as well, like, I'm going to see someone about potentially not being able to do something that's supposedly so natural.
And what are some of the factors that do impact when someone is struggling?
So yes, I like to talk to my couples about 6 things in terms of pregnancy, and the acronym is SSROOP. So the first thing is sex. So having sex at the right time during a menstrual cycle, that's most important. The next thing is sperm, and it's one of the reasons why whenever I have a heterosexual couple come to see me, I need to see both the male and female, because it takes 2 to tango. And we'll look at the sperm quality and make sure that the swimmers are indeed swimming. The next thing is having a receptive uterus, a uterus that's structurally normal with no impediment to pregnancy, so nothing like fibroids or potentially endometriosis. And the next one is ovulation, and some women just don't ovulate regularly, such as women who've got polycystic ovarian syndrome. So for those women, obviously they may need some help in order to achieve pregnancy. The next thing is having open tubes, because if your tubes are blocked, then the sperm's never going to meet the egg, so there's no chance of pregnancy. But probably the most important thing I say to people is patience, just having a bit of time. If you've been trying for more than 12 months and you're under the age of 35, then you really need to see a GP or a fertility specialist about investigating what might be the causes for your infertility. But if you're over the age of 35 and you've been trying for 6 months, then it's best to see a fertility specialist a lot earlier at 6 months.
So if someone is struggling to conceive, what are some of the options available to them?
That's a good question. A lot of people come to a fertility specialist thinking that they're going to do IVF. And of course, there's a multitude of other things that we can do in order to achieve pregnancy. So for couples who just aren't having sex timed around ovulation, it may be as simple as doing a tracking of the cycles, where we do ultrasound scans to determine when ovulation is occurring and tell the couple when to have sex during that time. For women who aren't ovulating, giving tablets or alternatively some small injections in order to facilitate ovulation and better time sexual intercourse, again, is going to achieve pregnancy. And of course, for those women who are in same-sex relationships or alternatively single women, utilising donor sperm and being able to inseminate and use that as a form of achieving pregnancy around the time of ovulation is going to be a way of conceiving as well. And of course, for those couples that have had a long time in trying to conceive and we've utilised other methods in order to try to attempt pregnancy, then IVF might be an answer.
So if you are struggling to conceive, now is the right time to start talking about it, and also to get all the information. Make sure you talk to your GP and also seek advice from a specialist.